Skid Row Housing Trust was founded in 1989 to preserve the residential community in Skid Row and to provide housing opportunities for the most vulnerable in the community who wouldn't have access to housing otherwise. So Skid Row has been a residential community for over 100 years. But we lost a lot of the residential housing in this community, which started to produce some of the street homelessness we saw in the 1980s. And to reverse that trend, the trust was founded to create permanent housing opportunities in the community that would be safe and high quality and that the people in the community could afford. And soon afterwards, we realized that people absolutely need permanent housing, and that is the solution to homelessness, but they also need the supportive services to go with that so that they can remain stable in their housing. And so we pretty quickly moved to the permanent supportive housing model. The Abbey is our 21st development. We have 20 developments that are in operation today because we're redeveloping actually our first development we're going back to and redeveloping now. Of the 20 buildings that are in operation, we have over 1,300 apartments. In the early 90s, we started with case management, which is extremely important in terms of helping people navigate the very complicated service delivery system that we have in Los Angeles. What we found is for people who had been on the streets a long time and had multiple disabilities, case management wasn't enough because our homeless service delivery system was too fragmented. And so in the past 10 years, we've started on a model that integrates case management with on-site primary health care, substance abuse treatment, and mental health treatment, because those are the three primary areas of disability that our residents often have. And by integrating those services on site, we find that people with multiple disabilities are able to get the treatment they need and get better and remain stable in their housing. 80% of our residents remain stably housed. Of the 20% who do leave, 10% go on to other positive outcomes. They reunite with family, or they might need a higher level of care and they might need to go into a nursing home if they're older. Or they may decide they want to go into residential drug treatment, but often it's positive outcomes, which means that 90% of the people who enter housing remain stably housed and continue to have positive outcomes in their life and are not homeless again. You know, when it comes to trying to get people into permanent housing, the biggest obstacle is that the application process is extremely onerous. We're using multiple different funding sources, federal, state, local, city, and every different level has different requirements. And so when we go to lease up a new building, people have to go through many different hoops to try and get the appropriate paperwork so that we can meet the requirements of all our different funders. And it's really difficult. And people who are very ill, have been on the streets a really long time, have a really hard time navigating that process. And so that's one of our barriers, is how do we make that process easier for people and assist people so that the people who are the most vulnerable and need this resource the most are able to get into the housing. The other thing that happens to people that Pamela was talking about is that when you're homeless, you have to start over every day anew. Because you don't have stability in your life, you don't have a safe place to work from, you're constantly starting fresh every day. And it just makes it really difficult to get on your feet because you can't find a shower, you don't have an ID, you haven't eaten anything, your medical needs haven't been taken care of. Every day is this new crisis and this new challenge, and it's really hard to move people to a place of stability from that without getting them a roof over their head. That's where stability starts, is when you have a roof over your head.